The three types of treatment that your ERISA disability carrier expects you to get in your Moyamoya disease claim. Now, a diagnosis of Moyamoya disease can be devastating, and its complications like strokes, seizures, visual disorders, cognitive impairment can lead to an ERISA disability claim if you have a policy. The ERISA disability policy or plan is going to require that you get reasonable and appropriate medical treatment as a condition to getting your ERISA disability benefits. And it's an ongoing obligation. And as the ERISA disability carrier or plan is looking at your medical records, they're going to expect that you have gotten certain diagnostic studies and certain types of treatment. There are three types of treatment that I think the ERISA disability carrier is going to expect that you'll see. Medication, and that's particularly true if you've had a seizure. The carrier will expect that you are taking anticonvulsant medication to prevent further seizures. Now, if you've had a stroke, the carrier would expect that you have been prescribed blood thinners to decrease the likelihood of a further stroke. Now, one of the many complications, unfortunately, of Moyamoya disease are headaches. And the carrier will expect that you will have gotten treatment for those headaches and that you're taking medication like channel blockers or headache medication. The second form of treatment they may expect is surgery. Now, a disability carrier can't make you undergo surgery, but they will expect that you have undergone, at a minimum, revascularization surgery if your brain scan shows low blood flow. And additionally, if the testing suggests that you're at risk for a brain aneurysm, the carrier might be reviewing your records to see if you have undergone surgery to prevent or treat a ruptured aneurysm. The third thing they're going to expect is therapy. Now, the therapy can take different forms. You might be expected to have physical therapy, occupational therapy, even speech therapy to deal with the complications from a seizure or stroke. Cognitive complications are not uncommon, and that can be very tricky in an ERISA disability claim. The carrier will expect that you have undergone neurocognitive testing to corroborate your complaints of memory loss or problems, particularly with executive functioning. Your complaints alone are not going to be sufficient. If cognitive behavioral therapy has been recommended, I will tell you the disability carrier is going to closely review the testing and expect that you will have undergone that therapy. And of course, they're looking for the results of that therapy. They're looking for a reason to deny a claim because they don't want to pay benefits. And in fact, they may use a 2-year mental nervous limitation to argue that in fact your problems are not the result of the Moyamoya disease, but an underlying psychiatric problem or psychiatric problem legitimately caused by the Moyamoya disease. If you've got a provision in your policy that says your benefits are limited to just 2 years, if your disability is caused or contributed to by a psychiatric problem, that contribution language can potentially result in 2 years of benefits. So you can see there are a lot of issues in a Moyamoya disability insurance claim. If you have any questions about your rights to benefits, call us today at 727-894-3188. We have experience dealing with these claims. 727-894-3188.